Welcome to Healing with Her, the podcast where women in medicine share bold and honest conversations from the front lines of healthcare. Step into the world of Black women medical professionals as they unpack the power of healing, the weight of care, and the beauty of showing up whole.
Welcome to Healing with Her, the podcast where women in medicine share bold, honest, and healing conversations from the front lines of healthcare. I'm your host, Dr. Brianne Wilson, and I am very thrilled that you're here. Whether you're a healthcare professional, a patient, or someone passionate about wellness, you'll find stories here that resonate, educate, and inspire. The information shared on Healing with Her is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare providers with any questions you may have regarding your health. The views expressed by the hosts and guests are their own and not necessarily reflect those of their institutions or their employers. So this podcast was born from a shared truth that healing isn't just about medicine. It's about connection, listening, and leadership. And who better to lead these conversations than women physicians? Today, I am honored to introduce you to 7 incredible doctors, my co-hosts and collaborators, each bringing their own story, specialty, and spark to this platform. You'll hear each of them today, and they'll also share what's coming up on some of our future episodes. So at this time, we are going to meet the doctors, and we'll start to my left.
Hi, everyone. I'm Dr. Pamela Reed. I'm an internist who has practiced in Buffalo for 30 years, providing primary care to those in our community.
Hi, I'm Emmy Kool-Aid Nylander. I'm an OBGYN, board certified with my private practice, Buffalo OBGYN. And I enjoy taking care of women and delivering babies and caring for people.
Again, I'm Dr. Brianne Wilson. I am a podiatrist, and I own Pure Podiatry of Westbury, New York. My goal is to help people put their best foot forward, specializing in people with diabetes, helping to treat any foot and ankle issues. I treat people from 0 to, I think my oldest patient is 103. I am board certified in foot and ankle surgery as well. And I'm just so happy to be able to share things with you all during this podcast.
Hello, my name is Dr. Kimberly Wooten. I am a board-certified general surgeon who currently specializes in head and neck surgical oncology. What drew me into medicine was really seeing my grandfather struggle with interacting with his physicians and receiving poor quality care. So what drives me today is making sure that I can walk hand in hand with my patients while they go through what is oftentimes the most difficult part of their lives.
Good evening. My name is Teresa Rush. I'm a board-certified OBGYN, and I've been in practice for about 33 years here in Buffalo. I'm one of the members of a group called Audubon Women's Medical Associates. I work with 12 wonderful ladies. We treat women from their teenage years up until postpartum to postmenopausal. So great to be here with these lovely ladies.
And my name is Dr. Melissa Neal. I own my own private practice here in Buffalo called 2020. We specialize in dry eye as well as aesthetic medicine. So my thing is to help people look and feel beautiful. And one of the things I love about being with these ladies and how this was inspired is just wanting to bring to people of color and our own community interesting ideas, as well as give you valuable help that you can take and share with your family. So I hope that's what we're going to do.
And also who is not present is Dr. Jalise Sosa, MD, MPH, FACOG. She is a board-certified OBGYN, a minimally invasive gynecologic surgeon who specializes in comprehensive care of patients with fibroids and endometriosis. She is dedicated to elevating women's health in Buffalo by building systems of care that are innovative, community-centered, and focused on quality. Dr. Sosa believes that the care of a person receives should never be determined by their zip code, income, or background, and works every day to help level the playing field in access to gynecologic care. And that is very evident. Unfortunately, she's not here at our premiere podcast because she's probably delivering babies or something. And I had the privilege of actually having her deliver my baby, so I know how awesome of a doctor she is. And so I want to take some time to just get to know each other a little bit better, and have everyone go around and talk about, I know Dr. Wooten talked about it earlier, but kind of what drew them to their path in medicine and then their specialty. Dr. Neal?
Okay, so mine is kind of a little bit funny. So you remember the Bill Cosby show?
Yeah.
I was 9. I saw him and I was like, I'm going to be an OBGYN. So that was when I was 9 years old. So I told everyone. I had people tell me when I was in high school, even my guidance counselor was like, you're not going to get into medical school. And I was like, okay, one visit and that's it. And got into medical school and I did my OBGYN residency and I hated it. So I was like distraught. I was distraught. I called my mom and said I wasted my life, and I went through a whole bunch of rotations. And it was one day that I spent with an ophthalmologist because I'd never experienced that, and I absolutely loved it. And so after that, I've loved my job ever since. So yeah, that's what led me to medicine.
There were several things that I was thinking about when I was thinking about what I wanted to do with my life. I can remember specifically a girlfriend of mine going into a doctor's office after she had broken her arm, and they had set her arm with a cast, and she just felt so uncomfortable with the whole process. And she lived out on a farm. This was in South Carolina, and I can remember asking her several questions about what did they say, are you going to do therapy after, all of this stuff. And she goes, I don't know. She felt uncomfortable to the point that she just wanted to leave. And that kind of stuck with me in that, wow, she wasn't getting the care that she needed because she felt uncomfortable in the process. She didn't know what questions to ask. And so my thought was that, boy, it would be really nice. And I did. I in New York, because I went to school in South Carolina, but I was also in New York City. And I really liked it, the clinic that I went to. I liked my doctor. And my experience was that if you developed a rapport with your physician, you could talk to them just like you're just going, hey, and you felt comfortable enough to open up. So when I went to med school, I thought I was going to go into neurology. Yeah, that lasted about a hot second. And I finally went into OBGYN because I really kind of felt that gave me an opportunity. It was an opportunity to sit down with women and young girls, form a relationship. I was hopeful that they would feel comfortable enough to ask questions, to see that anyone could do this, because I don't come from a medical background at all. So I'm like, I was hoping to make that connection, to be inspiring as well as to educate and to make them feel comfortable in that setting.
How about you, Dr. Narendra?
Well, I always knew I was going to be a doctor. From the time I was like 7 years old. I told all my friends I'm going to be a doctor, and they always said that's the one person I knew was going to do what they said they were going to do. It wasn't an easy process though. Okay, so I took my time, and I was an older student when I went to medical school, a non-traditional student, but I always knew I wanted to educate women about their bodies, because in this profession especially, you find all women from all different backgrounds who really don't have a good understanding of their bodies and how important it is to protect their bodies. You know, like young girls, I tell them all the time, your body's your temple. You choose, you know, who enters your temple. Okay. And so I'm happy that I'm able to do that. I'm able to educate young girls. I'm able to deliver babies, create families, you know, and that's given me a lot of joy.
How about you, Dr. Wooten? Why ENT?
Well, it actually wasn't going to be ENT. I was interested in medicine because I was watching the show, what was it called? Doogie Howser back in the day. And I wanted to be this genius doctor. And Doogie Howser did everything. He was, I think, an internist. He did everything. He did surgeries and all that stuff. So not realistic, but I didn't know that. And probably from the age of 4 or 5, I wanted to be a surgeon. Like I wanted to cut on people. As a kid, I had a dog called Teddy Ruxpin, and I ruined it because I operated on him and took him apart. And my mom was like, "Why did you do that? This cost $100." And so I knew that I wanted to be in surgery. I wanted to be taking out disease. And so when I went to medical school, I really just had surgery in the mind, and it was fortified by the fact that I really fell in love with oncology. And so when I did my surgical residency, I hadn't seen anything like these ENT head and neck surgeries in my life. And the patients were neglected. They were people who were disregarded by the medical community because they're smokers and drinkers, and it's oftentimes considered that these vices are not conducive to like treatment. So they tend to be non-compliant, tend to have poor social networks. And I felt that it was an important space for me to help patients who had no voice, no pun intended, because I do take out people's voice boxes. But they really had no voice, and they had no one to advocate for them. And so that's the reason why I went into ED.
Okay. So I would say that my story is pretty similar to Dr. Nyland and Dr. Wooten. I wanted to be a doctor since I was 6. And my sisters, I was like, I never knew somebody who wanted to be a doctor, you know, knew what they wanted to do so young, and actually did it. And like Dr. Wooten, I like cutting stuff. I know, right? I used to love lab where you like cut the frog, where you cut the worm. I like all that stuff. So, you know, I went through definitely different phases of what kind of doctor I wanted to be. First, I was like, oh, I want to be OB. I was like, no, I'm not delivering babies because they come when they want. I don't need anybody in you know, I went through the whole plethora of different kind of things. And so I actually picked feet. You know, this is going to sound very, I hate feet. What? I know. I love the people connected to the feet, but I do not like, so for like instance, my daughter, she's 3, right? She's so cute, but if she rubs her foot on me, I'm like, I don't like that. I can touch them, but they can't touch me. I don't know. I don't get it. Wow. That does not.
Very interesting.
But I think I'm a very good doctor. So I love doing surgery. And the other thing I like podiatry specifically is, for the most part, people can come in with an issue and leave with that issue resolved. You know, it's a lot of hands-on, a lot of, you know, doing different procedures in the office, which I really enjoy doing. And so, I mean, that is why I picked podiatry. And I think, you know, our stories are very similar, just in kind of like deciding what we wanted to do, kind of having a headstrong mind about what we wanted to do. Having the support, because you need the support, right? Because it's not easy. None of this was easy. But I would do it again. I definitely enjoy what I do. And I'm just happy to be able to have this space where we can share, you know, our different experiences, you know, maybe even being an outlet to other young girls who would see us and be like, if they can do it, I can do it. And I definitely am involved in the community a lot, where I try to mentor young girls. And I'm like, listen, there's really nothing that special about me, right? Except hard work and being able to, you know, go through the work that needs to be done. So Dr. Reed, let us know what your path to medicine was and how you chose the specialty that you went into.
So my passion really was science and also a love of people. And so the two of those things married well together. I have a family history that's riddled with diabetes and hypertension and end-stage renal disease, which is not uncommon for a woman who comes from a Southern family, right? And my desire was really to try to empower my family and my patients to understand their illnesses, to develop a plan for the management of their wellness, not just their physical health, but their mental health, their spiritual health, all of that, because everyone's wellness definition is different and everyone's path to wellness is different. And so my passion was to have people understand what their wellness journey would look like, right? To define that for themselves and then to help them make a plan to reach that wellness that they saw. And it's really an individual path, right? We all define that wellness for ourselves differently. And so to help people define that, right? So you have to be reflective about really what is it that you're trying to achieve, right? It can be something as simple as you want to sleep better because you know when you sleep better, your day is better, your mental health is better. So it can be something as simple as that or something more, right? You have cardiac disease and you really want to improve your heart function. So whatever it might be, what I wanted to do is to empower people to reflect on that, think about that, and then develop a realistic plan for themselves to improve their own wellness.
So the other thing I'm noticing about all of our answers is getting people to understand, helping them to better understand their health and whatever specialty that we are in, to help them understand, to be able to, ask those questions, to be a better advocate for themselves, which I think is amazing. And so, the next question is basically like, think about a unique experience or challenge that you've had as a female physician. And whoever wants to go first. I feel like Dr. Neal has something spinning in her brain.
I mean, I think for me, the challenge wasn't just being a female physician. I think it was actually being an African American or Black female physician. Just from what people thought I was able to do. Also, when I don't know about, maybe we all have that experience, but often, like sometimes where I went to school down south, they actually, it was hard to be smart and also be good. So I work in, eyes and beauty. It's people used to say, well, you're too pretty to be a doctor. So that was very common. Or they underestimate you, because of how you look or you talk so I think for me that was very challenging. And then also even just starting my own, private practice. I mean, being on your own ophthalmology is a very tech and equipment. So like finances and things like that, all of those are challenges. But I think from what we all talked about, one thing we had is we really wanted to fall in love with being a doctor very early on. And we realized no matter whether it was straight through or taking time to find that path, is determination. And I think for anybody who's thinking about being a doctor, that's one of the things. Just if you fall and you stumble, get back up. Because, definitely if we all can do it from the different paths. So yeah.
So I'm younger than almost everyone. Not. So probably for me, because I am older than most of you, it was not common for a woman to be a physician, and certainly not a Black woman, right? And so I would have incidents where I would be the attending physician, the physician that's leading that team, right? And I'm in my white coat with my name, I'm a MD, and I explain everything to the patient. This is, of course, a treatment. And then they would say, so when's the doctor coming? And that was not an uncommon thing, right? And so it was that people underestimated, right? Me, certainly. I've held many administrative and leadership positions, right? That people underestimated me, and soon found that was not the case. Right, that should not happen. And it's it's that always having to know more than anyone else. So, right, I've never taken a position where I didn't know more than the other people in the room, because they expect that you don't know, and so that has been a challenge my entire career. Not so much later in my career, because then you build a name for yourself and people understand that you were forced to be reckoned with. But yeah, that was certainly a challenge when I was a young physician.
So many, right? But one thing was interesting. I'm one of the owners of a group of women that we started off. There was 4 of us, and I can remember our chairman at our graduation from our residency. They didn't have any women groups when I started, and that was a long time ago. And I can remember his introduction, because one of my associates, partners, is also still with the group, and we graduated together, and he introduced us to the rest of the class and say, oh, this is Dr. Rush, and she's going to that women's group. And I just looked up and I'm like, what's he talking about? And then he introduced my partner. He goes, and she's going to the other women's group. And so it floored me how the concept of a woman in business and having a practice was so unique. And we did get, we were more, I remember being on labor and delivery. And yes, you're there at all times of the night. And coming from a woman's perspective, we're helpful. If I see someone trying to change a patient or turn them over, I would do that. And I would help. That was not below us. But yet, it really was interesting to me how they still were very deferring to the male positions. So we had to kind of forge some type of relationship such that we were taken seriously. But at the same time, it was interesting that even over the years, and even to this day, the guys do get quite a bit of acknowledgement, block time in surgery, all of these things. And we really still have to kind of fight for that. It's interesting, but you kind of, over the years, I've enjoyed, the tail side of that is I enjoy the camaraderie with the staff. I love the fact that in a private practice, you own it, you run it the way that you want. You're not listening. If we decide to do a new project, it's just like this podcast. It's on the floor and it's running with it. We're not waiting for someone higher up who's just their bottom line is the moolah of it. Our bottom line is that we care about our patients and we want to give them the best that we can, and we're able to do that in a private practice. So I don't regret. I love what I do. I love I see my partners as my sisters. We fight. We all have our strengths and our weaknesses, and it's just been a great journey over the last, I have to say, 33 years so far and counting.
Dr. Wooten, so tell us about your experiences.
Well, my experience with specifically what was the more challenging events that I've gone through. I am in a practice with all men. So all of my partners are men. And I do find that even though I'm seeing the same number of patients in clinic, it takes me a little bit longer. So my clinics run longer. And I never really understood why, but I think a lot of it is the expectation that as a woman, I am supposed to listen, be much more nurturing. Whereas many of my partners are very quick, curt, and to the point, and that's acceptable. Versus when I do that, a patient will complain and say, well, I didn't have all of my questions. You know, spent 30 minutes with them, explaining the disease process, explaining the upcoming surgery, and all that. So I think there is an inherent bias towards female physicians, the expectation that we are going to be naturally more attentive, more patient, and in a very busy business where you have to see patients on time. I think sometimes that can be a bit of a challenge, especially when my administration only sees the numbers. They don't see what goes into that time. So I find that for me, that has been an issue that I think is specific to my sex, and the fact that the expectation as a woman is somewhat different from those of men. And I think the second issue that I wanted to bring to light, and this is just me personally, but I did feel, especially in medical school, that when going into a surgical subspecialty, I was told almost that I have to choose between being a good surgeon and being a mother or having a life outside of work. And I think that expectation was not, I don't think my male colleagues experienced the same thing. I felt that I could only do one and I could do both. And that seemed to be a very heavily repeated concept throughout medical school, throughout residency, throughout fellowship. And for some reason, it made me feel like I was less than because I couldn't have it all. And I looked at other subspecialties where there were, a lot of my mentors were female doctors with families, and I felt like, why can't that? And so for me, that was something that I'm working on that now.
Okay.
But I would, if I could go back to baby Kim or med school Kim, I would tell her that she could have everything. And that I shouldn't be afraid to get those things because the world was telling me and the culture was telling me that I didn't.
I would say I've had it. When I first started practicing, I practiced in a group, all white men, and me. So, some of the things I experienced and still experience to this day in my own building, in my own practice that I've been practicing for almost 10 years is when I walk into the room and I get this look like, like, hi, I'm Dr. Wilson. They're like, oh. I'm like, yes, how are you today? And then I always am like, so what did you expect? And some of them are like, oh, I expected a white male. I'm like, so what about Breanne Wilson said white male? So between that and commenting on youth or, looks, things like that. Yeah. So, oh, you look too young to be a baby. You look like a baby. You're little. Now, before I would get aggravated. Now I'm like, oh, thank you. I still look young. But before I used to be like, amen, sister. I used to be like, I'm good and grown. I've been to school, residency. I've been working 5 years. At that time, I had been working however long. But even still to this day, you still get those comments that you have to deal with. And even once I had a patient who I walked into the room and I hadn't seen this person for quite a while. And it was an older lady. And I walked into the room and she was like, first thing out of her mouth, she said, you're getting fat. I said, I'm not. This is what I said. And I don't take it back. I said, I'm not fat, you mean old lady, I'm pregnant.
Oh my God.
Yes. And then she goes, you didn't have to call me mean old lady. I said, the first thing when somebody walks into a room and says hello, you should say hi. Now, you're getting fat. I was like, that was very rude. And I was like, I didn't appreciate it. And so you like just dealing with those kind of comments and just like, and I'm sure our male counterparts typically do not have to deal with the criticism about how they look, what they're wearing, weight gain or weight loss, because I deal with that still constantly to this day. You know, so like after I had my baby, you know, I gained some weight because I'm okay. I'm pregnant. I ain't trying to be figuring it out. So then after I had the baby, you know, I lost a lot of weight. Hey, you getting skinny. Why? So, you know, we have that to contend with, right? You have to have a certain aesthetic or this and that. And it's always commented on. It's just like, how can I help you today? Sometimes I have to go in the bathroom and be like, who's and then I come back out. What about you, Dr. Harlan?
Well, very similarly to all of you ladies, especially to Dr. Rush. I was with a male practice. Initially, when I first came out, I was a salaried employee. I thought that's what I was going to be, right? And we were working for two men that basically positioned us to work all over Western New York as underlings. Okay. And so they were reaping the benefits of our hard work and telling us that we weren't making enough, we weren't doing enough. We were at 4 hospitals. We were, yes.
Oh my God.
I was in a different clinic every day of the week. I was pregnant when we decided that we wanted to venture off and do our own thing. And we knew we could do it because of groups like Dr. Rush's group and other all-female groups. And so we would meet, you know, in a local, I won't say bar, but restaurant and write down our business plan on a napkin. And, you know, it was all very, very undercover. And, you know, I had my baby early and I was on maternity leave when we decided to go ahead and forge our practice and hand in our resignation. And I'm like, am I really doing this? I'm like, I just had a baby. She's in the NICU. I don't have a job. I'm like, what am I doing? But it was knowing groups, other people had done it and were successful because they told us, oh, they think they're going to be successful as an all-women group. Women's groups aren't successful. I'm like, who are you talking to? Exactly. That's what I'm like. And here we are 15 years later, you know, still here, still thriving, you know. But it was always the naysayers, right? It's always the ones who say, oh, they're never going to be successful. They're never going to be able to do anything. Both those men are gone out of Buffalo. Okay? Both of them are gone. And we're still here. You know, so it's instances like that, you know, in the OR, you know. I'm at Sisters now, and Brienne's not there with me anymore. We were the only ones, the only Black female surgeons. Only Black female surgeons. Wow. So, I'm there. Okay. If I have to be okay.
But yeah, I mean, you know, we all have unique experiences, but very similar themes.
Yeah.
And that's why I think it's important for us to have this space, to have this podcast, to be having these conversations. Why do you think it's important for women to lead in these types of conversations about healthcare, about wellness, you know, just what's going on within themselves, within their families? Why do you think women are so important to the conversation, Dr. Rush?
I think we tend to be the caregivers in the families. And that's going where I'm just going to say where mama leads is usually where the whole family goes. And if she can feel comfortable in from little getting them into their pediatricians, healthy diets, exercise, and feeling confident. That's not, when I think about wellness, yes, it's about health, but it's also feeling confident in who you are, what you can do. Because I'm quite sure we all had parents who told us that we can do anything. My dad was such a great example of that. Had maybe a, I don't know, 6th or 7th grade education, and self-taught himself to be an upholsterer. And I saw that. Wow. He had a business for 40 years in Brooklyn, New York. People would come back when we had furniture that we actually was good and took it back. Yeah. But I saw that. That's my dad, but behind my dad was a strong woman. And I never saw them kind of, going back and forth at it. But she took us in to get our checkups. She took us in for our dental appointments. All of that. And she made it so that type of a lifestyle, the moms. Right. If it was left up to my dad, I don't know if he would have taken me in. But that type of health, and then together seeing them in their own ways make something out of, without backgrounds in business or any of those things, to achieve. And to look at you and say, honey, you can do anything you set your mind to. So that women in that position is so important. I think most of us talked about the young girls in our practices, and I love the when I can just sit and listen to them, and when I see them kind of veering off and making some decisions that I'm like going, whew, I'm very quick to say, I'm taking off the actor's hat right now. Yeah. I got auntie or mama's hat on right now. What are you thinking? Right. Or you can, you're on the right path. Just kind of continue doing that. So, women are, our influence in the home, in our workplace is so strong. These kind of discussions are so important, especially nowadays when the economy may make it a lot more difficult. After COVID, when everyone was sequestered at home and you're trying to find your way and how to do this, trying to get through school, and having that mother, that father, or whoever your family members are, to be there for you and to continue encouraging you and to be there with help. Right. And encouragement. Yeah.
What are your thoughts, Dr. Nanda?
Very important, because Black women especially are considered the bottom of the barrel, right? The most disrespected person in the United States of America is a Black woman. So we are seen but not heard. Okay, and so it's important for us to be present and to have them see us and hear our voices and not take us for granted. Okay, because as you said, we are the ones, we are the caretakers, we are the leaders, and we can be enormous, beautiful, strong, proud leaders, if we're given the opportunity. Okay, and so, yeah, it's very important that they hear our voices, hear us, and what we have to say, and what we have to contribute to this country.
I think for me, it's important for young women specifically. I went to RIT. I went there, I got a biochem degree, and then I decided to pursue podiatry. I hated RIT. And when I tell you I hated RIT, like I hated RIT. Not a bad institution, great institution, great education. But culturally, it just wasn't. And so, I had a great mentor there, female who was there, not on the club, but she was there. She kind of helped pull me in and helped me to, stay the course and finish. But I literally was about to be out. Like I had an application to Boston University. Why Boston? But anyway, I went to Boston University. I wanted to go to Boston for some reason. But, I stuck it out, did 4 years. And so now I currently sit on the RIT Alumni Board. And the reason why I chose to do so is to help ensure that, women who look like me don't have the same experiences that I have. And so there is now it's getting better with kind of helping women or people just in general get into medicine because it's not really known for, a medical school or pre-med or that kind of thing. And so I have a couple, mentees. They graduated. They did amazing.
Congratulations.
Well, one specifically, I had a conversation with her. And like you said, you got to take off the doctor hat and you're like, listen. And she had been through some things. Only 20, not even 21, about to graduate. Like, brilliant girl, doing very well. And she was just so stressed about the next steps. And when I say having been through some things like death, a major death in the family, a major breakup, and she's just trying to figure out what to do next, I said, you need a break. You need to stop. You need a break. I said, it's okay to take a break. And I think for us to be able to have these conversations and not only show our strength, but to show our vulnerability. It's okay. You do not have to be the strong Black woman. You don't have to be. Take the time, take a break, take care of yourself. And I'm so happy she listened to me. She decided to take a gap year because she does want to pursue medicine. I said, but at some point, you're going to get burnt out and it's not going to be good for anybody. It's not going to be good for you. It's not going to be good for your patients. And so for me, just to be an example, to young women, be an example to my daughter. Do I want her to pursue medicine? Nope. But that's not here or there. But just so she can see, that she can do whatever, she wants to do. But to be able to be there for someone, there are some people who go to school and whose families don't have that background to be able to help them to figure, what the next steps are. So, to be able to help in any way I can, or, one young lady, she wants to be an OB and I got her with, Dr. Sosa because I'm like, I do feet. But, to be able to have this space where we, connect and be able to connect other people to, whatever it is that they need, I think is important. What do you think, Dr. Neal?
I mean, I like everything that you guys were saying for the mentorship. But I also, I guess it's, so we as, like you said, the Black woman, we're not heard but we are the cornerstone of our family. So sometimes, there may not be a male counterpart there. So we kind of are leading the ship. And if we and ourselves are healthier, and also, like you said, I think being a strong Black woman is not only forging ahead no matter what, but it's also being strong enough to say, I'm sorry, I can't do that. I had to do that a lot and learn that, where I was trying to take on everything because we're like the strong Black woman, we can take on everything. Mm-hmm. But we have a breaking point, and I had where I took on so much where I was like, I had to take a mental break for a year, and I realized that being a strong Black woman is not just forging ahead, it's also saying, I can't do that, or, saying I've had enough, or today mommy's done for the day. You know what I mean?
Absolutely.
I would say I can't do anymore, or today, I love you.
Yes.
And I'm good, but you're not listening. No, I am. But I'm going to zip my mouth. So to give you a little to talk about therapy when you're older.
So, but you told me just that. But anyway, no, but that I think, and the other reason is, there's been studies where, if a woman has like where she's, I think Black men, they don't go to the doctors very often. They don't really take care of their health. But if you have a woman who is loving that man, she will urge him to take better care of himself, and he will live longer. So I feel like speaking to, Black women and things like that and moving that also helps our Black men. So I think that's important.
Love that, Dr. Reed. So I think in terms of us leading these conversations, I think of that leadership in two environments, right? One is the leadership within our practices with our patients, right? Because our patients self-select, right, their physician. And I don't know about all of you, but probably so. The majority of my patients were Black women, right? And to be able to forge that bond of understanding that we've had these shared experiences as Black women, it helps to create trust, which we know is not something that is necessarily happens in our community in terms of trust in the medical system, right? But this gives us an opportunity to create that trust and to then build healthier families. Because as Dr. Rush said, it's that female figure in the home who is kind of leading the way for the rest of the family, right? And so that's one part of it. The other part is leadership within our community, right? So that we have that voice to say, this is what's happening in our community, and this is, from a leadership standpoint, how I feel it needs to be addressed, right? Because I've listened to the community, right? I know what their concerns are. They've told me what their needs are, and then we can lead that improvement in the health of our overall community, right? And so that's kind of how I look at it.
I love that. Exactly.
Well, I think all of the prior points were excellent. What I would like to highlight is the statistics. So we know that women in general, and I'm sorry, I'm talking mostly about surgical, but it extends to other subspecialties as well. Female surgeons actually have better outcomes. So clearly we're doing something right. And additionally, when you match the patient background and ethnicity with their physician, they have better outcomes. So we should be leading the charge because we're reflective of the community. They will respect us, listen to us, and we give them, I think, better care specific to their culture, their sex, their concerns, their issues, community-based concerns. I think we're better able to address.
Love that. And I think too, because the relationships that you build with your patients. Because I know some of my patients, I talk to them like they're my uncle, my auntie, my sister, my cousin, like, okay, what are you doing? I need you to get your life together because make it make sense. Right? So we can have those conversations with them like that because of, kind of culturally how it works. And they're typically more apt.
Receptive.
Yes. And apt to listen to us. All right. So this has been a wonderful, wonderful discussion. And I just want everyone to go around. So we had a great brainstorming, right, a few weeks ago about all the different possible episodes that we're going to have. And I just wanted to go around just one more time to maybe think of one of the episodes that either you're going to be involved with or one that you're looking forward to that we are going to have during the season of Healing with Her.
So I think for me, the segment that we'll have on mental health, especially for our community, is one that I'm looking forward to and is much needed. It's great that it's become more of a topic of conversation within the community, within families. And I think having people understand the importance of having those conversations and giving them resources to access that type of care, which might be difficult, and specifically culturally sensitive care is kind of one of the things that I'm looking forward to from our podcast.
Well, as an OBGYN, there's a lot of topics. But I know we've talked about mental health, maternal health disparities, and how women can advocate for themselves and how they come to an appointment for prenatal care, for menopausal care, for postpartum care, how they can feel comfortable asking certain questions, because sometimes they don't know to ask questions. And so be able to guide them and show them how they should present themselves when they come to a physician's office with concerns.
So for me, obviously, it's going to be focusing on your feet, right? So many people don't realize, how important their feet are until they have an issue. Kind of one of my pet peeves, which I probably will go into a lot on a soapbox, is proper shoe gear. Wearing shoes that are 20 years old, maybe get some new shoes before you come out to. That's neither here or there. But how people, just the importance of proper foot hygiene, how your feet or, things that you see in your feet and your legs can actually be something more systemic, and how to look for different things, especially, in our community, a lot of diabetes. My ultimate goal as a foot doctor is to help you keep your feet. Right. So I am a surgeon, and I unfortunately do have to do amputations from time to time. But if I can properly educate you on what to look for, things to avoid, how to better take care of yourself, then, that's what I'm looking forward to. Dr. Wooten.
Well, as a surgical oncologist, I would love to advocate for specialty-specific screenings and making sure that as a community we're getting our breast exams, we're getting our gynecological exams, we're getting our colonoscopies specifically. And then to also look at less commonly, but very important in terms of overall physical health, is dental health and dental hygiene. As a head and neck surgeon, I oftentimes see patients that have no teeth, or teeth in such poor repair that it affects later stages of some of the cancer treatments or even affects surgical complications. And so while that's something that's not really focused on in medical communities, as well as in some of our cultural community discussions, we really don't talk about dental care and how important it is for our patients. I see it oftentimes in patients who get radiation with very poor dental hygiene, then have severe complications such as osteoradionecrosis necrosis or osteomyelitis of the jaw, which can lead to long-term quality of life issues and high morbidity rates. So I think that's very important for us to bring and shed some light on. And then as a side note, because I do a lot of thyroid surgery, I obviously want to talk about thyroid health because that's, full body health.
Yes. I love it. All right, Dr. Rush.
Well, I'm one of 3 OBGYNs, so we're definitely going to get into prenatal, postnatal health. I kind of I'm excited about talking about health care for women prior to getting pregnant. Because that's, to me, you get pregnant, we have moms that are getting pregnant that are older, and some of the things to think about in terms of their health, exercise, mental, because some women are so focused on getting pregnant, they get pregnant, and then they're like anxious the whole time, and I'm like, going, this is such a great time. Really, what can you do to make this experience great for you? I would love to talk about fibroids because, yes, I think most of us have experienced that, and the different things that you can do in terms of treatment nowadays for fibroids. It's not simply either take my fibroids out or take my uterus out. There are so many different modalities. And because our community is plagued by fibroids a lot, and I think, and this is just my opinion, I think a lot of it has to do with we get older. We put on a little bit of packaging here, and we'll talk about how that may impact how fibroids grow. And it's not simply, I feel fine about the way I look, and we should, because, yeah, we got it like that. But you might want to
Right.
change that up a little bit to help from a physical standpoint in terms of fibroids. So, OB, the fibroids, and hormonal replacement therapy, and going through. There's some good information out there, but I'd love to have a discussion about some of the new things that are on the internet, and as people are doing their research, what's reliable information? What should we be as women careful about? It's not for everyone, and there's probably a lot of things that we can do to help ourselves, minus medications, taking time out for ourselves, so the aspect of that conversation is going to be interesting.
And last but not least, Dr. Neal. Okay, so, well, I'm an ophthalmologist, so of course I'm looking forward to talking about the eyes, although I like the eyes.
And I operate on them. I think they're the most beautiful part of the body, so I do. They are.
Yeah. So I love the eyes. So I want to talk about, diabetic retinopathy, how to protect your eyes, how the things that you should be having. Because some people don't go for eye exams. And one of the things that kind of, struck me was an ophthalmologist. I had a 40-year-old man come in and he was blind from glaucoma because he had 20/20 vision, but he was bumping into things. So a lot of people think, well, I have perfect vision, don't need to see an ophthalmologist, but you should because it runs in a family, so that's very important. The other thing I'm very excited about. I'm excited about that we're going to be talking about because I also do aesthetics, so about skin, about acne. I had very bad acne growing up, and when we get acne, we get hyperpigmentation, that can really affect our self-esteem. So that what we can do for that really excites me. And I also, some of the non-medical topics that we talked about financial literacy and those kind of things. I'm looking to do kind of those other interesting kind of things because wellness, like we all said, it's overall, it's financial wellness, it's mental health, it's, physical wellness. So I'm excited about just to get to sit and chat with you girls.
Or women.
But still a girl.
Yeah. Well, I'm so excited about this time. I'm so excited about having our first episode. That brings us to the end of our very first episode of Healing with Her. Yay. So you have just met 6/7 women who are not only doctors, storytellers, advocates, leaders, and healers. Each of us brings something unique and different to the table. We all believe the same thing, though, that healing is a shared experience and it starts with honest conversation. This podcast is a space for truth, for community, and for redefining what care looks like when women lead it. We're so grateful you have joined us today. Be sure to follow or subscribe wherever you listen so you never miss a moment. If today's episode moved you, share it, tag a friend, send it to a patient, drop us a message, and we would love to hear how Healing with Her resonates with you. New episodes every 2 weeks. And please remember, while we are doctors, this podcast is not a substitute for personalized medical advice. Always consult your own healthcare provider for guidance specific to your health. Until then, take care of yourself and keep healing with her.